Are you experiencing chronic thumb pain where you feel weakness? It's hard to open jars and grip things. You might even feel numbness or tingling or burning into your hand. Well, if so, check out this video. Hi, my name is Dr. Ariane Missimer. I am the owner of the Movement Paradigm Integrative Health Center in the Philadelphia area. I'm a functional medicine practitioner, doctor of physical therapy, and registered dietitian. And today I'm going to talk to you about carpal tunnel. So you or someone you know might be experiencing this where you just feel like it is so hard to do the things you need to do because of this debilitating pain. Now, what are some of the things that may cause carpal tunnel? Number one, of course, can be repetitive activity. So things like using the mouse all day and doing repetitive type labor, or even things like knitting or sewing. Any of these things can be a trigger, but we want to recognize that there's always an underlying cause. Now, some other things that you may not have thought of are things like hormonal and metabolic issues, inflammatory issues, even things like RA, systemic inflammation that you might be experiencing. Even type 2 diabetes and thyroid conditions are correlated with carpal tunnel. So we want to know that there are a lot of reasons why this might be happening. But one of the things that I feel like is always missed is that we want to recognize that the carpal tunnel is one specific area. So when we're referring to carpal tunnel, we're referring to compression of the median nerve that is going to exit the cervical spine at C5, C6 and comes down the arm into the hand and really into these three primary fingers and even a little bit into the fourth here. And so what can happen, of course, as I mentioned, is you could feel weak and you could feel painful, just basic activities, even using your phone. And so because of this, we want to think that you're going to go right to surgery. And that is not often the solution because this is one specific area of compression. But the median nerve can actually be compressed at multiple levels. Of course, starting from the spine, it can also be compressed as it comes through in the scalene area in the neck. It can also be in the pronator teres right here in the forearm, and even actually the pec minor. So there's multiple areas where it can be compressed. And what I always find with my patients is that they're going right to surgery, which creates more scar tissue, more trauma, more inflammation, and typically more problems. I've very rarely met many patients at all, if any, who have had a successful outcome to carpal tunnel surgery. Now, there are specific cases that it definitely is warranted, and I totally understand that because we can have anatomical changes in our bones, even women compared to men, the structure is a little bit different. So there's lots of reasons why you may be predisposed to it. But ultimately, we always want to come back to what do your mechanics look like? And so when I'm assessing carpal tunnel, I'm never just assessing here. I'm really assessing everything that's happening in the neck, in the spine. So we want to think of some basic things. So are you able to have full range of motion, pain-free range of motion in the cervical spine? So you can go ahead and do these tests with me. So when you go forward, are you able to touch your chin to your chest? When you go back, are you able to look up with your face parallel to the ceiling without any discomfort? Are you able to turn fully to one side? Are you able to turn fully to the other side? Is there any pain? Is there any reproduction of your symptom? Are you able to bring your chin all the way down to your collarbone? And same thing on the other side. So is there symmetry among both sides, between both sides? Is there any pain, any other type of compensatory pattern? Are you able to breathe nasally? So are you able to maintain the tongue at the roof of the mouth? So that's your resting position of the tongue so that you can, when you breathe in through the nose, your abdomen is able to expand fully and contract fully without using the neck and shoulders to breathe. So these are some basic things that are so important to understand, because if there's any compensation in even just these simple patterns, when we know that there's most likely going to be an issue a little bit higher up in the chain. So even when someone is complaining of arthritis in the thumb, that it's gotten weaker and more painful over time, most likely that has been caused by median nerve issues, which has been caused through some type of neck involvement. So it's really important to just be able to look at all the the other aspects. So when we're thinking about potentially getting surgery for carpal tunnel, there are so many factors to consider, and it's really essential to look at all of the reasons. And I've had way more people than I can count avoid carpal tunnel surgery, be totally fine, and be able to be higher functioning, even weight bear on their hands, and I know that's hard to imagine if you have it, without getting surgery. So it's just something to really look into, just like we do with all of our other movement or pain or health issues, is looking to the root causes as best as you can. Now, what can you do? So in an acute phase of your carpal tunnel symptoms, of course, while you're trying to unpack why it's happened to begin with, whether that's repetitive use or that's any of the other things I mentioned, at this point, you do want to try to immobilize it as much as possible, especially if you have to continue to do activity. So if you're typing and you're, using your mouse, all of that, it is nice to use a brace where you can keep the carpal tunnel a little bit more stable in that acute phase, even for sleeping, because that can just protect you from, not sleeping like this, compressing it all night, waking up with excruciating pain in the morning and weakness. So that can be just a little bit of a protective measure, and then can be started to wean out as you start to feel better. Identifying what those repetitive activities might be that are causing it and trying to make some changes. So that can be some basic ergonomic things that you're doing at work, getting little wrist support, taking breaks is the most important thing, and also just learning how to optimize your posture. So perfect posture does not mean no injuries. I wish it did. But you can start to see where you're compensating. And the most important thing during the day is breathing and movement variability. So instead of trying to find the perfect posture at your desk, it's more important to get up and move. So every 30 minutes, you want to be changing positions, up, down, moving, walking, anything, movement snacks, because that is what your body prefers, not prolonged positions. When we start putting hours and hours in this position with our neck forward, closing our airway, all of these things are going to contribute to potentially pain and inflammation. And then, speaking of which, inflammation. So if the nerve is inflamed, there are things that you want to think about from a overall health standpoint. So looking at things like your diet. Is there anything that you are eating, or maybe even drinking alcohol or excess coffee, or things that might be putting you in a more inflammatory state? So that, of course, you can check out some of my other videos to understand that. But ultimately, there could be things that are creating a little bit more inflammation. Stress, food, bugs, toxins, and trauma, and hormones are all things that could potentially be driving into that. Of course, working on your movement. Now, this is going to look a little different for each person because it depends on what is happening for you. So, for example, are you lacking in shoulder stability, core stability, so motor control, which means sequencing, timing, coordination? So if this is happening, then that's going to make you more likely to compensate at the wrist and elbow. And so that can, of course, perpetuate the cycle. So working with a professional, I think, is really important. Get a great movement assessment so you know how you're moving and what you need to do to correct that, or a physical therapist, of course. And lastly, when the time is right, which is not in the acute phase of your carpal tunnel syndrome, is nerve glides. So nerve glide, essentially what you would do is you could stand up against a wall to use that as support. So if you are up against the wall, you can place your opposite hand on the shoulder and press the shoulder down. That's really important. You want to really depress the shoulder. And you can start without actually any wall, but I'll just use my desk here as a little guidance. So you have your fingers down, your elbow is bent. So I'm going to start from here. I'm going to straighten my elbow, flatten my palm, and then turn my head. Okay, so I'm come back to center. So this is my breath in and breath out. So you only want to go to the point of tension. You do not want to create more symptoms. So if you do a few of these and it makes your symptoms worse, this is not the thing for you right now. If you do a few and you feel like there's less symptoms, then that means that you have more nerve tension, and this is an appropriate exercise for you. You would only do this, I recommend doing 1 set of 10 to start. You can assess it, you can see how it feels. If it feels good, no more than 3 sets a day of these. and you ideally want to work with a professional to make sure that this is appropriate. But this is when, if we think of our flossing our teeth, so we're putting the dental floss through the teeth, our nerves are flossing through our muscles. So we're not stretching the nerve, but we are getting the nerve to glide through the tissue more freely. So when you've had chronic issues, this is going to be really important in addressing everything. Okay, I hope this was helpful. If it was, of course, give it a like, give it a share, and subscribe to our YouTube channel. We appreciate it. And we love your comments too. So if this was helpful and you want more guidance, you can reach out to us directly. You can schedule a discovery session. We would love to help you on your movement or health journey. And you can also join our Movement Paradigm app, where we have an amazing community. We have a great group of people that are all focused on whole body health, high quality movement programs, mindset, nervous system regulation, nutrition, so much more. So stay in touch, and I will see you soon. Bye.